guys. I'll just give us a few minutes for our extra special guests to join in. Happy Thursday, everyone. It's pre-Friday. There we go. Hey, Strawberry. There should be like a request button. I know Instagram updated, so it's kind of weird, but there should be a request button. Hi, everyone. Not good. Thank you, thank you. This is my quarantine outfit. Not shoulderly, LOL. So maybe, I don't know if there's a way that I can, oh wait, here we go. It says unable to join. Anyone who can watch the live videos will be able to join. So Strawberry, I'm trying to manually add you, but it pops up unable to join. It allows me to add everyone else but you. Are you following Whitman-Walker on Instagram? Let's try this. No, it's saying unable to join. It's literally allowing me to add everyone but you. Oh, here we go. Hey,
Hello, hello.
what's up?
Nothing much. How you feeling?
I'm feeling good. Just a few technical difficulties, but we made it. We're here.
You know that's how it always happens. It's the best.
Okay. Well, I'll just give us maybe like 1 or 2 minutes just to allow others to tune in and kind of hop on because I know it's 1 o'clock. People are like on their lunch breaks and they're scrolling. So we'll just give them a few snaps.
Sounds good.
Okay, here we go. So how are y'all doing?
Good. As best as we can. I'm sore from working out at home. Ugh.
I love your hair, Strawberry. It's such a mood.
Thank you. I only grew it because it's on my bucket list. Once it touched my shoulders, it's gone.
And of course, I live for braids 24/7,
Thank
so
you.
you know I
That's
say
all
it.
she knows well. They're easy. Exactly, they're easy.
Okay, so it looks like we had a few extra people hop on. Okay, so I guess we can go ahead and start. You guys ready? Phone was ringing. I don't know why it did that, but okay, we are back. So hi everyone. My name is Marshawn, the original Whitman-Walker Instagram Live OG. My preferred pronouns are he, she, and queen, and I work here at Whitman-Walker in the community health department as a community outreach specialist. During the past few months, Whitman-Walker's community health department has expanded its outreach efforts to social media platform. We cover various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions. Our series of outreach sessions also focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. So first, I want to thank everyone for joining us, our viewers, and our extra very special guests. First, we have one of my favorites, Derek Strawberry Cox, who is an artist, Whitman-Walker Health board member, and client. And last but certainly not least, we're joined by the lovely Allura Lloyd, and Lloyd is actually my middle name, who is an artist and a Whitman-Walker client joining us today to discuss their experiences around getting tested for COVID-19. So let's get started, and everyone, please feel free to participate in the comments below. Feel free to ask us anything. This is a space for us. Strawberry and Allura, thanks for joining us. Do you mind telling us a little bit about yourselves?
Sure. I'll let Aurora go first.
Okay.
Yeah. So I am Aurora Lloyd. I'm a trans activist advocate, as well as a event coordinator for Way Home America, part of the True Color National Youth Forum, as well as I am a RA over at Smile. And then on my personal time, I'm also a recording artist.
Oh, yes.
And good afternoon, everyone. I'm Derek Strawberry Cox. As you know, I'm an HIV/AIDS advocate here in the DMV area. I fight for all our health rights, all our rights in general. I sit on the board of DC Council, of Whitman-Walker, of BHT, Black Pride, and Capital Pride. I do what I can for the community at large, and I'm here to help if needed.
Okay, y'all are busy. Thank you
Yeah.
both for that. Now, do you guys mind touching on what got you involved at Whitman-Walker and what brought you to Whitman-Walker?
Well, when I first heard about Whitman-Walker, I heard about Ryan White first. So I Googled like a gay doctor and and Ryan White came up, and then Max Robinson came up. So I went to Max Robinson first, and that's how I heard all about Whitman-Walker.
Mm-hmm.
And I got involved with Whitman-Walker long before I became HIV positive. And I found my lovely doctor, Miss Lindsay. And
Yes.
I've been with Whitman-Walker since then.
Okay.
I learned about Whitman-Walker during my transition out of Howard University. Yeah, I was trying to find a doctor here in DC because I'm not from here originally. And that was kind of like the popular one, and so that's kind of really how it started. And I started transitioning and going through everything with Whitman-Walker from that point on.
Yeah, kind of same. Like, I'm not from here either, but I just always heard of Whitman-Walker. I'm like, what is Whitman-Walker?
Yeah.
But thanks for sharing that. Do you mind sharing your initial reactions and thoughts when you first started learning about COVID-19? And what did you think the impact might be on Black LGBTQ individuals?
Well, when I initially heard about COVID-19, I was like, oh, Lord, here we go again with something else. You know, we had HIV, we had STDs, you know, we had monosyphilitis, we had all these made up things. And I was like, oh, now we got something that came from China or Japan, wherever.
Mm-hmm.
And then I was like, here we go with the Black people, our community being all crazy with all these assumptions and saying the government made it and this was planned from the beginning. I was like, well, here we go again. Especially during the time now with the Black Lives Matter movement, it's just too much.
It is. It really is. Two pandemics in one.
Yeah. I repeat the question again, so I make sure I answer this correctly.
I'm sorry. What was it?
Repeat the question again.
Sorry. what were your initial reactions and thoughts when you first started learning about COVID-19? And what did you think the impact might be on LGBTQ plus individuals?
My initial thoughts was like the fact that I guess it wasn't the fact that our generation is like really disconnected from news
Yeah.
and news outlets.
Mm-hmm.
Our primary like news source is through social media.
Right.
And so if we're not seeing it on our favorite blog sites, then we're not seeing it at all, even if it's stuff going on in other countries. So, and for something that started in another country and builds up to the point where it starts to spread and it hadn't really gotten touched on here publicly, it threw me off because it was just like, well, why didn't we know about this a bit sooner? Why are we just now finding out when it's already going, like everything's going downhill? And then I was immediately fearful for the community. Ultimately, because especially with being at Smile, you know, we're working with a younger generation, and they haven't really gotten to experience something of this nature. You know, 80s babies, 90s babies, we've gotten a good brunt. I'm not far behind you. We've gotten a good brunt of different pandemics and levels of war and casualties. Like, we've experienced a lot within our time frame of 20 to 30 years, where they either were born in the midst of or got the brunt of the ending of a lot of that. So it's now like a glanced over topic in their history books for the most part. So they really didn't know how to react and take to this, and some of them really just didn't take it seriously, and that's where the fear came in, because they didn't know how serious it was in nature.
Yeah, and I completely understand that. When I first heard about it, I'm just like, oh, this is just something new against us. But I honestly didn't take it serious either. And like you said, I do get the majority of my news information from social media. Just because I feel like the news is a lot and it can become overwhelming at times. So I completely agree with that. It looks like we had a few people tune in. So those of you who are just tuning in, feel free to ask us questions at any point. We are discussing experiences with COVID-19. And then my next question for you two is, I know both of you just recently got tested for COVID-19 at Whitman-Walker, correct?
Yes.
Yes. Okay. Do you mind sharing why you felt it was important to get tested and to also record your testing experiences?
It was I think for the both of us, there was a level of fear within doing it, honestly. But there was also a level of like, well, we know we haven't really gone anywhere. We haven't really done anything. Myself, I just would go to and from work. And so we went into it with very mixed feelings. And then the tests that are kind of portrayed on news outlets and social media, it makes it look like it is the most dreadful experience. So we were like, we psyched ourselves up together, like, we got this, we gonna make it through. Because we were not ready for any insertions of anything inside our noses. But lo and behold, it was not what we thought it was gonna be at all.
Well, I figured being one of the many faces of the community, I figured that we should do it. And so I was like, okay, I said, let's do it together, because, you know, like I said, you don't know if you're a courier and you just don't have any symptoms. So just to make sure and be careful and safe with it. We, like she said, we encourage each other to go. And I was like, we're going to record it so that way when other people, I'm going to try my best when they see it, to see if we can get other community leaders to also record when they go do it, if we can, you know, encourage them to go do it, just so we can show everyone that, you know, it isn't such a big deal and it is something that you can easily get done, especially if you're going to continue to go out or if you're not going to wear the mask, because I'm with it. We all tired of wearing the mask. They hot, it's sweaty, it's irritating. Trust me, I understand. But it's so funny to me because, you know, when I told so many friends and families that I was going to go get the test, they was like, no, don't do it. They're going to give you the COVID-19. They're going to give it to you. Why you going to do that to yourself? I was like, it's a damn Q-tip. It's coming fresh out of a pack. It's just I was like, but see, this is why that encouraged me more to do it, because everyone was still in the same ideal of how easily you can get infected with COVID-19 just by going to get a checkup for it. And that was crazy to me.
and the parallels that it has to just how it was just getting tested for HIV back in the day. It's scary that that same idea and principle that was present back in the 80s
It's back.
is here. It is 2020, and people still are keeping that mindset of if you go get tested, they're probably trying to give it to you.
Right. And I'm just happy to hear that you guys like had each other's support throughout all of it, because I know like a lot of people are already nervous, and just, you know, having like a friend or someone there just kind of like makes it less scarier. And I've never received a COVID test before, although I do believe that it is very important to receive a COVID test. And I am aware of, you know, the huge importance of getting tested. Like I said, wearing a mask, like you said, Strawberry, and physically distancing yourselves from individuals. But yeah. So now we're gonna really get into some things, you guys. So my next question for you two is, what was your experience like getting tested? Like, how was the scheduling process for your appointment? How was the actual in-person visit? Just because I know personally, I work for Whitman-Walker and I'm answering the phone calls. And I do know that we have a higher call volume lately and longer wait times. So how was your experience from scheduling to testing to getting your results?
Well, the experience was fairly easy. I would like to note to everyone that Whitman-Walker has updated their phone system, so they're taking all phone calls and
And we
taking
have.
everyone. Okay,
And we
so their
have.
phones work. So I don't want to hear no more. You can't reach them when no one's picking up the phone. If you call, someone will help you. It was
Absolutely.
fairly easy. I called the automatic system, took me to someone to set me an appointment for the COVID testing, and they told me which location I could go to that was available for it.
Okay.
And once we got there, it was just easy peasy. Like, they made sure we was comfortable. We told them we wanted to do it together because we was recording each other. They was okay with it. So overall, it was just about communication and comfortability.
Yeah, and they did a great job of making sure that they had a level of distance throughout the entire process. Literally, once we got in there, they sat us in a room by ourselves together. We answered the questions through the phone that was in the doctor's office, and answer all the questions. So then all the doctor really had to come in and do was administer the test and be done with us.
Okay.
So it was extremely simple.
And how was the receiving your results process? Was that simple as well?
Well, so the receiving results, yeah, it was real simple. Because probably like a week or so, week later, you get your results. They call you, let you know that you even got it or you don't. Sometimes they can even come sooner than a week, I've heard. So that's even great and better.
Okay. And thanks for sharing that. I'm glad to know it was a smooth process for you both, and you were vulnerable to equally share your experiences with the world and record it, just because I personally have not seen anyone do that, especially like two friends. Excuse me. So my last question for you two, before we cruise through the comments, is why do you guys think it's important for folks, especially LGBTQ Black individuals who are currently experiencing two pandemics at once, like I said, to follow COVID-19 prevention guidelines like wearing a mask that covers your nose and mouth, cleaning your hands with soap and water for at least 20 seconds, staying home when sick, maintaining a 6 feet distance from others, and getting tested if they have symptoms or have an exposure?
Well, honestly, it's very real. We not only have we had friends who contracted it, we've also had friends who've passed on because of it. Right. We've attended like 3 funerals now.
Yeah.
For folks who had it and passed on, and it was great. Actually, it was their birthday today. Yesterday. Today was their birthday.
Oh, happy birthday!
Shout out to Perry. Rest in peace. Like it's a very real thing, and it's very scary, and especially for youth and those who still stay with family members, especially if their family members are older and above like the ages of 40 and 50. You really have to be cautious because their immune system is even more at compromised in that situation if they were to catch COVID. So it's very real. It's something to take seriously. Adhere and do all the things that you're supposed to do, that they tell us to do, for the sake of not just yourself but for others. because
Yes.
there's already some articles going around now of those who did not do such or weren't aware that they didn't do everything they were supposed to, and someone that they knew or was close with in time contracted it, and they contracted it from them and they passed. And that I can only imagine that level of guilt someone would feel to know that, to feel like, oh my God, this is my fault.
Right.
Because like no matter what anybody would tell you, you will still feel that no, this was on
Hmm.
me.
Absolutely.
To me, I just feel like one thing that irritates me about our community, and I love my Black beautiful kings and queens, especially in the LGBTQIA plus community. I love them all, but what irritates me so much with so many people is that we wait till the last minute till something happens for us to actually care about something,
Yeah.
regardless of how important or how unimportant it is.
Sure.
So it's like if you see something happening, I feel like it don't have to affect you to affect you. You know what I mean? Like it don't have to happen to you to affect you. If it's
Hmm.
happening around you, that should be enough right there. You know, I don't like that we wait till the last minute till something happened to us or someone close to us to actually start caring and then realizing the importance of this. It's just like, if the information is out there and is vividly exposed to you everywhere on social media, buses, your phones, alert, laws, everything, and you're still ignoring it, I really don't feel I'm gonna still be hurt, but I really don't feel that bad for you if you contract this stupid virus. And like she said before, it's just like going back to the HIV situation. Like you don't want to accept it and you don't want to deal with it, but then you feel bad if you find out that you have it or that you gave it to someone else. Why wait to that moment? Just take care of it. And trust me, I know we're tired of being in the house. I am tired of being in the house. We be putting on full concerts in here for our cats. Like it's hard to keep yourself busy, but I mean you learn so
Okay.
much about yourself when you have your alone time, which is beautiful. And sometimes you do other things like working out. That's what we're trying to do. But it's hard for Black people to stay in the house because we don't like staying in the house. And I get that. And I'm tired of putting on that mask. I'm tired of walking to the store, forgetting my mask, almost getting there, and then having to turn back around to go get it. I'm already over it. I'm gonna go tomorrow. Like
Yes.
I'd be irritated with it, but I'm still serious about this pandemic because I don't want no one that I'm close to be harmed by me, or I don't want to be harmed by anyone else.
Right.
Because I know a lot of people that's been having parties, or that's been celebrating themselves, and they be like, "Oh, you coming?" I be like, "How many people you gonna have over there?" They gonna have their masks. I
Okay.
might stop through and say hi, say happy birthday, drop off a card or a gift, then I bounce, something like that. But other than that, I already got HIV, so I gotta take care of me, keep that U equals U over here. So but I love y'all though.
Okay. Okay, yes, and like you said, it's very important, which is why we're having this session now. And for
Mhm.
those of you who don't know, I've already pinned the comment in the live video. If you do need scheduling or if you just have questions about anything, feel free to schedule an appointment here at Whitman-Walker. We have 2 locations who are offering testing. And I'll just kind of like cruise through the comments because it seems like we have a lot of little things here.
Yeah, it's a lot
So
of responses.
yes, booked and busy. We do love Dr. Lynn, period. Absolutely. 2 pandemics in one. We have a combo.
Yeah.
Okay, so we have a question. What advice would you give to young LGBTQ of color that still want to party and engage in sexual activity during this challenging time?
Well, we both have kids.
Yeah.
So with my child, I talk to him because he likes to go out a lot with his friends. But so I talk to him. I just make sure that he make sure he wear his mask. If he do anything, like I tell him, if you're gonna drink, make sure you make your own drink. If you have your own bottle, that'd be better. Just try to keep everything to yourself. Situation type scenario. I know he like to smoke weed or whatever, but I'm like try not to share. Too many mouths. You just try to stay to yourself. You want to go out, just protect you. It's not saying that you got to cut people off or whatever, but just be all about you. Just protect your barriers, man. Because, I need everybody to be safe and keep their self safe first. And I know it's hard for us to go out and not be around each other and not embrace each other. But I can give you that
Right.
strong elbow before I give you that enduring hug. But I love you regardless.
Yeah, and like you said, like you are your safest sexual partner when it does come to COVID-19. And if you do, this is just me giving some advice. If you do decide to engage in sexual activity, just try your best to limit your partners the best you can. So that's my advice to LGBTQ youth. masturbation is safe because you're doing that to yourself. And like I said, if you are going to engage in sexual activity, try not to have so many, just because so many interactions just kind of like increases your risk of contracting COVID. Let's.
I mean, and just to add to that, I've seen people have, well, not like visually seen them have sex, but I've seen people have sex, with the mask on, just no kissing, no foreplay, no oral, just, got the business done and went about their way. So, there's safe ways to go about it, ish. Yeah.
I have seen that as well, which is interesting. And it looks like we have one more question. Should someone get a COVID test when trying to social distance and stay at home? I don't want to take a test away from someone who really needs it.
Yeah, I've heard that as well. But we went to go get the test just because, and because, like I said, we don't know even if we was curious, because we just don't know. Because a lot of people say it's airborne or whatever the case is. So you just don't know unless you try yourself. And a lot of tests, they've gotten numerous of tests now. So now you can, if you feel like you're having symptoms or if you just want to know, you can just book an appointment and go get tested without worrying about taking that test from someone else who really needs it.
And it's not the one you've seen on social media where it's like this thing this long Q-tip they're sticking all the way up your nose.
Okay.
Literally, ours was the size of half the size of a regular Q-tip, and they push up for 15 seconds, twist, and pull out. Ooh. And they do it for both sides. And I promise you, it doesn't hurt. It just makes you want to sneeze or scratch your nose.
Yeah,
it's like that's it. Possibly, yeah. I
mean, it's uncomfortable, but it's not painful. It's just uncomfortable. It's like a big booger that you can't get
out. Right. That's literally all it is. But it's so quick. So it's not like you're going to be there long, nor you're going to be in an immense amount of pain. But sensitivity is different for everybody, but it's not painful.
Yeah. And we're going to upload the video after this is over.
Definitely do that. And just to kind of like piggyback to the question, honestly, you're not going to have symptoms for COVID-19. So just because, you may feel as if you don't want to take a test, you may, in fact have COVID-19, because I've had a few friends who weren't symptomatic at all and got a COVID test and were actually positive. So I just recommend everyone getting tested. And I know I have to practice what I preach because I've never gotten a COVID test. But I do recommend it for everyone who feels as if, maybe you may have been potentially exposed to something. Let's see what we have here. I love the honest response. Thanks for the answers. You are welcome. We are here to help you guys. Period.
Indeed.
It doesn't hurt. There are a lot of unknown things about COVID-19, so getting tested is always a good idea. Absolutely. Okay. So like I said, you guys, if you're just tuning in, we are discussing COVID. We're pretty much done now. We're discussing COVID experiences. If you or someone needs COVID testing, I pinned a comment below where you can schedule your appointment or answer any additional questions. We can answer any additional questions you have about COVID. So yeah, I want to thank you two for sharing your experiences with your COVID testing and recording it, and also joining us today and encouraging everyone to get tested. Thanks to everyone who's tuned in today. We appreciate you guys for sharing this space with us, and learning more about what it's like getting tested for COVID-19. Strawberry and Yura, did you have any final messages for our viewers today?
I think the last thing I'll say is COVID's not a death sentence anymore. A lot of people lately that's been getting it are recovering from it. Mm-hmm. So it's nothing to truly be that worried or scared about anymore. So
I'm sorry, you guys. My work phone keeps ringing. I'm so sorry. I put my phone on disturb mode. I don't know why it's still ringing. But I'm sorry. Continue what you were saying, Strawberry.
Well, I was just saying that the COVID test, once you get it, it's not a death sentence anymore. So even if you do test positive for COVID, that you'll be able to overcome it. A lot of people have been doing so. So you just got to get tested, get your results, and then take it from there.
Yes. That's literally all you pretty much can do.
You
Get
know.
tested, physically distance yourself from individuals, wear your mask, wash your hands
Mhm.
with soap and water for at least 20 seconds. And that's really all we can do, Chad.
Yeah.
Okay.
Well, once again, I want to thank our very extra special guests for joining us and our viewers today. Be sure to follow us on Instagram, Facebook, and Twitter at Whitman-Walker for the most up-to-date information and more content. In addition to tuning into our youth team on Instagram at Real Talk DC _, you can also keep up with our BAG series, and that's BAG, BAGG, catered to women's health at No Filter DC and our Culture Center at The Corner DC. I hope everyone has a wonderful pre-Friday. Stay safe. See you soon. Thanks, you guys, for joining us once again. And the Live OG is signing off.
All right. Love you, babes.
Bye. Love you some more. Bye.